Hello and welcome to the Lens at 177, and today we are talking cancer, the terminal illness that plagues people and eventually kills them. And as we join Belinda Chan, the CEO of Fiji Cancer Society today, we will try to touch on this topic and see how the next government, the new government coming in, or the current government, if it proceeds to power, what can they do to help our cancer patients. Belinda, welcome to the program. First question to you is, why is an organization like Fiji Cancer Society important to Fiji?
Thanks, Anish, and thank you for the opportunity. I guess with the Fiji Cancer Society, we've been here for will be 30 years next year. And over the last, I guess, 7 years, there has been an increase in advocacy work. Everyone knows what the iconic month is, meaning October, so everyone knows what Pinktober is now. Everyone goes all out in pink. So we're here to do advocacy work, just stress to the people, educate people. Some of us have very poor health literacy. We don't understand what's happening with us, that we leave it till it's too late, then we take ourselves to be seen by the doctors. So, I mean, case in point here, my apologies to the Itoke community, they can be the worst people to present themselves to the doctors. If there's a little cough or a headache or something, they take an alternative, a herbal medicine, whereas with our Indo-Fijian families, they go straight to the doctor. So we need to do that. That's what the rest of the community, even the Rutumans do that, go late to the doctors. So we want to emphasize to people the importance of early detection, understanding what their body is going through, understanding they're normal, as opposed to when they're not, when they have these little bumps and lumps. So education, we also do screening programs, work with the Ministry of Health, go out and do screening in communities. Besides us, we have reproductive family health and MSP. And the other service we provide, which is pretty unique, is providing patient support services to those who are diagnosed with cancer. We see that there is a need, and in most cases, our patients or those that need help are those from the lower end of the socio-economic scale. And so they need, because they present late, and so they need the support. It can be financial and whatever support that's needed to be given to them. And cancer is not an illness that you should be taking too lightly. It's not an illness that you should be battling, so to speak, on your own. It involves and it affects the whole family. So if you're a parent, it affects not only you, but your spouse. It filters through to your children, and before you know it, the whole family network plus the extended network is involved. And so, for us, our mission is no one fights alone. And so we want to be there for people who have a cancer diagnosis, who need the support, and know that, there is someone there that can help them, that can provide them this. We don't do any clinical work, so to speak, besides the screening. All the clinical work, the treatment and management of the patients are done by the Ministry of Health. So we have an existing MOU with the Ministry of Health, and they do that. Parceled in that is also palliative care. Palliative care is something that, I guess it's a new word for all of us, but it's giving patients who are at their end stage dignity. At the end of the day, they're still humans. They need dignity of care. They need love. So for us, families and friends, we are there to provide that dignity of care. We want to ensure that as they transition into the next life, they transition with dignity, but also pain-free. So provide the support where we can minimize their pain management as they transition into the next life. So I guess that's how I see what we do. I'd like to think that our work is very important in the health sector. Dr. Anish who's the medical oncologist here at CWM, said that we are the humanitarian face of cancer. And over the years, I have seen it, and that's basically what the society is all about, being the humanitarian face of cancer.
So have past governments, current government paid attention to cancer treatment in Fiji in the way you would wish?
Well, I know currently there is in the budget allocation for the ministry, there's an allocation for overseas medical referrals. So in that, it's not only for cancer patients, but you've got those with other illnesses that can't be treated locally. However, their outcome is good, the prognosis is good if they get treated overseas. That's fine, but how much of that portion is, is dedicated to cancer? We have people who can't really afford, so it's normally a lower end of the scale, and some of them in time they get the financing needed to go across for treatment. No one explains to them, the experience they will have on the other end. I've heard people who have come back from India for treatment. It needs adjusting. There's so much, if it's not a insured travel, then it's pocket funded or semi-funded. They're there, but they're stressing over the money. When the money runs out, what happens? What happens when they come back? So it's the continuity of care back here in Fiji when they return. They may some of them return better than when they left, but what do they do thereafter? So it's something that we want to do. We want to help educate these people who opt to go because they can. And being humans, we don't want to lose our loved one. So if it's your mom or your dad, and the extent of or the severity of their diagnosis, irregardless of what, you just want to send them. And so you don't want to hear what the doctors tell you, but knowing in the back of your mind that she's fragile, she's going to have problems when she boards that flight, altitude, all those things come, but they don't, because that's your parent. You want to do the best. So with that overseas medical, so I've digressed, with that overseas medical referral, it's there in place, but there is a budget allocation, and it's just upon application. So it depends. Again, I would like to see government expand that a little to incorporate when they return, and help just provide some education as to how they can facilitate post-care when they're back home, and then just do the follow-ups or do the necessary referrals to the Cancer Society, and likewise with the insurance companies.
Would you or the Fiji Cancer Society like to see a specific hospital for cancer patients?
Definitely. It's a dream. Some say it's a wild dream, but it's a dream that can be achieved. Right now we don't have the capacity, the human resource, so we're lacking. When you talk about, there's education. We start from education. That needs to be strengthened. We look at, then you go to diagnostics, so pathology, laboratory, all these sections or departments that contribute to diagnosis, treatment, management, palliative, all these need to be strengthened, including data. So once we're able to strengthen that, the government of the day is able to strengthen that, then I think with that data, that information, we've identified, which areas needs improving, which areas, we've got we clearly have, dedicated, passionate doctors here in Fiji. But they're challenged in so many ways. They try and be innovative. Before I came, I received 2 requests for help to clear surgical backlog for cancer patients. So that's where we step into on the clinical side, where we can assist to ensure that the doctors are able to do the surgery, but at the same time, the patient also get the help they need. I don't know how long they've delayed the surgery, but it needs to be done. So having the hospital is one side, but the steps that needs to be taken to actually have that hospital, it's a long road, and it's going to take Fiji a while to do that.
In your lifetime, would you like to see such a hospital in place in Fiji?
Definitely.
Yeah.
Besides a cancer hospital, we don't have proper hospice. We have the old people's home, that's fine, but we need a hospice where not only cancer patients, but patients who have an illness, where they're able to check in, 2 or 3 days, family gets some respite, and then they take their loved ones back. That's what we need. But yes, in my lifetime, I'd like that, but I think it's going to be another 20 years probably.
Belinda, we'll take a short break and we'll continue the discussion after that.
We were around when the deed was first signed. We were around when the first car engine roared. We were around when the very first was crowned. Through devastations, jubilant celebrations, and the milestones. We will continue to be around to bring you all the stories first.
Welcome back, and Belinda Chan, the CEO of Fiji Cancer Society. We continue discussion on the topic of cancer. Belinda, what's the data telling you on an annual basis that's related to cancer? Is there any official data with you?
Okay, so how we collect our data, sorry, I have to go the other way. For the support we provide to cancer patients and their families is we get them to come and register with us. That's different to what the ministry has. So currently there is no holding data place for cancer. Each organization, each department within the ministry has their own data. So for us, we only know when a patient passes on is when we call, or when the home visitation team goes in to visit them. Or when the calling is just to check how they're doing and to see if they've taken any devices. If they're done with it, then they can bring it back. So I know from last month we lost 7, but there is still more that we haven't really identified. So data is an issue, having a proper data registry. There is a proper data registry. It just needs to be, continued from where they had left off.
Does cancer eventually kill, or can people be saved?
Kill if it's late presentation. Good outcomes if early presentation. So knowing you're normal. So this morning you stand in the mirror, you look at yourself without your clothes on, you say, that's what I look like. Then you touch yourself, you go, that's my normal. Then the next day, so whenever you feel something unusual, a lump or a bump here and there, then that should alert you. You may not necessarily need to have a cancer test, but you can have, what they do is they do other tests first, and then they do the cancer test later if you have a family history. But it's just knowing what's normal, and if you have others, the cough, the lower back ache, just go and get seen. So it's improving your health seeking behaviors, understanding what's out there, and presenting as you go along. Those that don't, those that pass on are normally those that present late. So in the case of breast cancer, because women can see their breasts, they know it's breast cancer, or they know there's something wrong with their breast, and they leave it too late. Prior to that, they've already, done the forest, the herbal forest. So every leaf, every bark, every grass they walk on, they pick, do it, and then they treat themselves. By the time they present themselves to the hospital, it's too late. It's fungated, it's stinking, nobody wants to take care of them, and then they expect the doctors to fix them. And they can't, it's too late. So if you present early, you can imagine the savings, right? The economic benefit it'll have to the hospital or to the public health system. If you present late, the economic benefit is, there's no benefit, it's a loss, because the amount of medication you have to take, the manpower, the people that need to take care of you, that increases. So early presentation is what we've always promoted and we've stood by, and we'll continue to do that.
But what's the most prevalent form of cancer gender-wise in Fiji currently being recorded?
So in women, it's breast and cervical, so it's kind of like up and down. For men this is based on our records, for men is prostate and liver.
Okay, if you were asked to ask government for funding towards the Fiji Cancer Society so that you can 100% do a good work, what's that amount you are looking at?
That's a good question. Like I said, there's so many points where we have to start from, and right now we're just covering all points and hoping that one day all the dots would actually connect, and then we know we've achieved something. We're still working on those dots. What I see currently for us at the society is the challenge for medication access. I want to see patients who at end of life stage have access to medical oxygen. It's their right. I want, so maybe I'd ask government to give me 300,000 to help me with medication, chemotherapy, drugs, have them to review the protocols, the chemo protocols, that we can update the medication, that we can administer these medication to the patients, and then have better outcomes in their treatment. I want oxygen. We've just completed the Bushels, Fiji's biggest morning tea, and funds from that will be directed to procuring medical oxygen concentrators. We understand the challenges people from the lower socioeconomic scale have, and so some, with concentrators, you need constant power supply, and so we have to find alternative to that. So maybe a solar operated concentrator. I'd like these people to have access to that, be able to have access. So yeah, that's going to happen, but that's where I'd also throw in the 300,000, not only to buy that, but supplies, dignity. Give them dignity, diapers. Sometimes you go and see patients, they're reeking of urine, they've got that fecal smell, they're not cleaned properly. Families sometimes don't understand. People, I still say it now, people still view cancer as a stigma, as the sins of the past, sins of the old people. That's why you have cancer, without realizing or understanding. So that's where, poor health literacy comes in for us. But we have to counter that with education. Yeah, I think by the time I finish, I'd probably have requests more than 300,000. But so the stigma associated with cancer is still evident out there in the communities. We live in the city, but you have, the peri-urban, the informal settlements. They still view it as a stigma. You go out to the villages, it's just as bad. We need to, learn to desensitize people with this. Okay, you and I may be too late because of our ages, but we've got a generation of young people coming up. They're our future. That's where the work needs to be done. So I guess not only to provide medication, but just about to help us to complement the work that we're doing, like how we're complementing the work they're doing through the procurement of medication, through the procurement of diagnostic equipment, that we provide to the Ministry of Health or to the hospital.
Is this prevalent in Fiji, the non-availability of medication for cancer patients? Is it prevalent, or is it one?
I guess I'd like to call it seasonal. During COVID, yes, we continued with treatment. However, now we see we only just supplied Lautoka Hospital with some paclitaxel. Not a big amount, just a small amount, but still, still a dent to our funds. But that's for our women, that's for our patients. Then we have little things, the essential medicine, the medicine that's on the essential drug list. So tamoxifen, which women who have had breast cancer, they're now on tamoxifen for about 5 years. So just supplying those cards to them, that's run out. I can't recall what other medication, but these are the ones that are essential as part of their treatment. That's not available. That should be available. And I guess the same thing would apply to those who are diabetic. The very basic metformin, if it's there. If it's not.
How do your staff, or maybe yourself, handle yourself knowing that somebody is not going to survive, he or she is going, and you haven't been able to do anything for him or her?
We've come across patients, we've interacted with them, we come to a stage where we know them personally, their likes, their dislikes. We even have them, do volunteer work at the society. And in most cases, they're women, and these women come with a background. They've been abandoned by their husband. They've been, or the husband is in jail. It comes down to the relationships, and then if you track that further down, it comes down to parenting 101. What was their background like? So when they pass, the girls in the office are like, they try not to tell me that someone, especially that I've grown fond of, gotten close to, has passed on. We don't take it. We don't do self-care for ourselves. The impact they have on our lives drives us to do what we do. But there are times when I think that they could have been offered better alternatives, if only this could have been done, if only. And it's, it comes down to the resources that are available. How do they access those resources? And these are the resources that are not available.
I see tears swelling up in your eyes. You are very passionate about this work. How long will you continue doing this?
I told my family I'll finish next year. But for me, it's one of my dreams to have a hospice. I want to ensure that palliative patients, irregardless of their diagnosis, that they have dignity. We've seen patients, especially in the village, and again, it comes down to education, lack of knowledge. They just leave them and they go about their daily chores. That's fine, but hey, she is aware of what's happening. She may not be able to communicate, but she knows what's happening. So they just leave her. She can't clean herself. Her hair's grown, her nails are long. So these are the people we want to come in, give them that dignity, give them, a few days, and then they go back home. But at the same time, teach family members how to care for them. They're still alive. They may not be contributing effectively to the family, but they're still alive, and they hear, they see, they smell what's happening. but we tend to ignore them, and we shouldn't.
Belinda, thank you very much. We'll take a short break, and we'll continue the discussion after this short break.
We were around when the deed was first signed. We were around when the first car engine roared. We were around when the very first was crowned. Through devastations, jubilant celebrations, and the milestones. We will continue to be around to bring you all the stories first.
Welcome back to The Lens at 177, and today we are talking to Belinda Chan, the CEO of Fiji Cancer Society. Belinda, you have Pinktober and November, I think. Are these programs really hitting the population in terms of awareness?
Yes, they are. It's nice to see Ministry of Health come on board, and then so I think for the month of October and this month, they were doing, they got their specialist doctors to talk about the types of cancer. So you had Dr. Rajiv talking about men cancer, the gynae team, I can't remember who was from the gynae team, but Dr. Ani was talking from lymphoma. So they all talked about their specialty there. Over the years with the hype, Pinktober hype, people now know that it's October, it's breast. However, the only thing that we need to change is the mindset that cancer does not only occur in October, because everyone goes all big and everyone thinks that you have to get screened in October. They forget that the other 11 months are there. October is just to raise awareness. So that happens, and we continue to encourage, people to talk about cancer. That's the only way you can raise awareness. You just have to incorporate them in your conversations, because you wouldn't know what the other person is going through.
Does our Ministry of Health has the HR capacity, human resource capacity, to treat cancer patients?
No, I'd say no. There's no specialist per se. These doctors, it's an interest, and then they have their other jobs. So you can have a surgeon, a general surgeon, but you also have this surgeon who also has an interest in breast cancer, and then when he has time, then he's able to do surgery for his breast cancer patients. So he will see both those that need general surgery, and then those that breast cancer, women with breast cancer, and then he has to, he just has to juggle his schedule where he can dedicate time to doing surgeries for those with breast cancer. So we need, what Fiji needs is dedicated cancer specialists, from across the spectrum.
And what positions, or who could they be?
So you've got, right now we have a medical oncologist. We need, surgical oncologists. You need a gynae oncologist. I think there is a gynae oncologist in Lautoka, but again, she plays multiple roles besides her role for that. And then you have the surgeons, and then you have urologists. Doc just does not only those related to cancer, but other and then the nurses as well. You need dedicated specialists, dedicated nurses to take care of you, as opposed to your everyday nurse that works in the wards, out in the wards.
Every year the Health Ministry is given 150,000 plus in their budget for Ministry of Health, and since independence everybody knows cancer has been in the country. Where do you think we have fallen back that this hasn't happened?
So cancer is classified as an NCD. So you have diabetes, and then you have cardiovascular. Cancer is seen as a third leading cause of death here in Fiji. It could be, and it could be not. You could have a cancer patient who has a heart attack. Cancer patient can be a diabetic as well, So I guess it comes to how you classify when it comes to cause of death is how you classify, and that is only known to ministry. With the budget, it's combined budget, so it addresses diabetes, cardiovascular, or heart and cancer. I know the bulk of the budget allocated for cancer goes towards cervical screening, cervical cancer. So cervical cancer, there's a global elimination strategy for 2030 to eliminate cervical cancer. Here in Fiji, as an NGO, we've started work towards that, and just building plans, and then just taking our cue from what the ministry has put out, and then just in discussions with ministry as to how we can run our programs. But again, it comes down to human resource. We only have one nurse. They have plenty nurses, but not many of them are skilled in doing pap smears. With the so there is, I know part of the budget goes towards cervical screening, and then medication, and then drugs. So maybe a very small portion of that 150, so to speak, if we can use that as a base.
If I were to ask you, are cancer patients neglected in Fiji by the state? What would your answer be?
I'll say yes and no. 5% yes. 95% yes, neglect, and no is the other 5%. The reason for the 5% is because there is treatment available locally. Surgery and chemotherapy is available locally, and there's no cost to that. All your diagnostic tests, everything that needs to be done is all done at the divisional hospitals at no cost. The other 95% I'm referring to, it would be the social support. Some of these, it's hard to take an elderly man who's looking after his grandchildren because his daughter passed away to the social welfare to go and register. He refuses because he still feels that he is strong enough to go to the plantation and get food, or go to the river or the sea, fish, and he can feed his children. And we've seen, I'd like to see some of these cancer patients who really deserve to access social welfare able to access that. And then some of them come with their other social problems again, those whose husbands have abandoned them, or they kicked out of their home. Where do they go? It can be our problem for a while as for cancer patients. When you come into the city, get treated, and then you stay with family, eventually you become a burden, and they too feel bad. So it would be nice to have some form of accommodation, available for them, that they could just stay, have their treatment, finish with their treatment, and they go home. Because they get within the home, they get to do. They depend on these people, the kind-hearted people, to take care of them. And then the family, they're probably experiencing hardship. So if there can be some way that there's voucher available, or maybe it's something that the Cancer Society may need to look at. But see, as I'm talking to you, I'm getting ideas. But it has to be considered, because there's so many factors that restricts people from seeking medical treatment or medical intervention. One, we all know hospital is classified as the Valenimate. So that's it. On the onset, that's it. I don't want to go. I will go when I'm ready, or present myself late. We need to change the mindset of that. But we need to give them. If we do that, we need to give them, have resources available that they can access. It's only short term, and then they go. Short term, go. This lady that came back from India, talking to her today, and her sharing her experience, coming back, and I worry, she's coming back, what does she have here? the continuity of care thereafter. Those that go away overseas get treated, even if you're insured, you come back, what happens thereafter? Again, all the dots need to be connected so we know exactly where we're at, or there is some improvement. But when you can't connect the dots, we're just going to continue to just work apart.
What's your message to children, sons, daughters, husbands, wife, towards somebody in the family who has got cancer?
Children whose family member has a cancer diagnosis, depending on their age, so if you're looking at those below 10, as adults, it's the norm that we don't say anything to them. But I believe that we have to tell them. They know what's happening around, and you can't come up with, you can't tell them, you can't distort the truth from them. They will know. They know, they see with their eyes, they have an opinion, they've already formed an opinion, and then they're thinking. Because what's going to happen, these kids are going to go and talk to their friends, and that's how it's going to continue. With family members, they too also need to be open. You need to talk. Within a family, they'll say, okay, don't tell anyone yet until we've told so-and-so first and we come back to you. It doesn't work that way. By then, as a patient diagnosed with cancer, you're already stressed, and that stress does not sit well with your cancer. The family members need to be there, support them any way they can. And even just sitting there holding their hand, that's fine. You don't need to have a conversation. You don't need to ask them, are you okay? Just sit quietly. It takes a lot of patience, a lot of understanding, but for me, I think at the end of the day, just being physically there, that makes a difference. You don't have to say anything, and show that respect, to them as well, because they're still here. They haven't left.
How often do you see a cancer patient passing on in the presence of their family?
I saw 3, and that includes my mom.
Can you explain? Can you talk about the personal experience you went through?
The first one was a very good, very close, dear friend, and she faced a lot of challenges during her cancer journey. She lost her father in a car accident. Her father got hit, and then then as she was going down, her husband decides to come back. And of course she's happy because he's back, but he's come back with a wife or with his partner. And that's okay. That's fine. She's just happy to have him. And no matter what you say at that point in time, you just want them to be happy despite what has happened. This is what they've been looking forward to. And that's closure for them. But for me, it wasn't. I was upset. I was annoyed. When he came to the hospital to see her, I was annoyed. I just wanted him out there. That when she took her last breath, he was there. I just didn't feel right. And I shouldn't have felt that way. But again, I've just jumped over that line where I got too involved. I had to pull myself away from that and reassure myself that she's gone, she'll be fine. But her having her ex-husband there, that was her closure. I don't care what happens to him, whether he gets closure on their relationship or not, but she needed that to end her life, And it's just mixed emotions, because you see to one, and then you know of other ladies who also go down that same, and this is what they need. They just need the closure. As much as we detest, the guys for doing this to them, but again, it's what they want, it's what they need, With mom was different. She had done everything she wanted to do. She had a do not resuscitate, and she just, I had to tell them that, that's it. And they said, no, we can still get her. I'm going, she's got a pacemaker, and she's signed the DNR, and for crying out loud, that's what she wants. And although I'm standing there and screaming at them, they must have thought I was a bit off, but it's understanding and I guess releasing them. At that time, it may seem cruel to other people, but because you've built that relationship with them and you know exactly what they want, you know exactly what they've been through to where they are now, you want the best for them. And the best for them will always be, if it's from a broken relationship and they present themselves, it's just getting that closure they want. They so need that. But, unfortunately, some people don't see it that way. And so, for those who are in that predicament now, with someone who is journeying with cancer, and, we also need to know that, understand the needs of the patient, of the individual, because they too still have their rights, until they've taken their last breath, then that's it. We just have to respect them. So like I said, earlier, that you don't put them there in the watches and carry on and do your work and then you come back and see them. No, they're breathing, they're listening, they're hearing, they're smelling everything that's happening. They need to be involved in the conversation. We don't do this much here in Fiji. We don't talk to our loved ones, whether they have cancer or whether they have heart problems or whether they diabetic. We don't talk to them about their wishes. What do they want done? Should they pass on? But it's something that we have to start doing, because if you want to give them the send-off they deserve, you talk to them and then you respect that after. Yet we tend to go back into that, we fall back on tradition, we fall back on culture, and then, it doesn't make sense. Someone passing, they're just passing in this life and moving on to the next one where they will be waiting for us. I mean, we're all Christians and we believe that, that day will come. So allow them that. Allow them closure before they move on. So it's, being with people who are ready to go or who just pass while you're there it allows you to, for me, rethink about my purpose, rethink about the work that I do at the society, but at the same time allow me to try and understand them a lot more and be able to carry that through within the work that I do.
Belinda Chan, thank you very much for talking to us, and that's the program for today. Join me soon when we continue the discussion on the lens here at 177. Thank you very much.